Death can be a frightening and stressful time. Healthcare professionals play an important role in preparing families, friends and carers for the death of a loved one. Family and carers under stress need various forms of support made available to them. They may need help and advice about how best to interact with their loved one. They may need counselling or someone to talk to about any conflicting emotions they're experiencing.
We sometimes use we often use our psychosocial team, which consists of psychologist, social worker for counselling. We also use bereavement counselling as well. Sometimes it's very common for patients' relatives to grieve for the loss of their loved one, even whilst the patient is still alive and deteriorating. And so often all those people can be very useful in giving support and advice and encouragement and pointing relatives in the right way in which to seek the appropriate sort of help. And that goes for all ages.
When death does occur, the healthcare team also need to be prepared to deal with the family's grief. They may need assistance contacting appropriate people for funeral arrangements. In any discussion, healthcare professionals should try to empathise and be as sensitive and reassuring as possible.
I think the most important thing, if you're talking about imminent death of a loved one, it's important that the person isn't alone, that there are other family members or friends or someone around to support them, because often staff will come in, deliver their news and then leave, and then that person's all alone. So I think having other supports around is really important. I think for the staff to have the right amount of time to be able to sit down and give it the attention that it needs to be able to answer questions that families have about what to expect in the coming days or weeks.
There are various forms of support healthcare professionals can make available to grieving families and carers. They may need advice about how to interact with their loved one, or need counselling to help them deal with any conflicting emotions. When death does occur, they may also need help making funeral arrangements. In any discussion, it's important that healthcare professionals are sensitive, empathetic and reassuring.